welcome to this edition of To Your Health. I'm Szymanski, the Chief Operating Officer at Marlborough Hospital. Today I'm very pleased to welcome our guest to talk about the importance of mammography for breast cancer screening. We're going to divide our show into two 15-minute segments today, so we have two experts that will walk us through mammograms and breast biopsies, and then the last 15 minutes we're going to spend with Pam Jassoon, who is a nurse at the hospital, who has recently been treated for breast cancer. That should be a very powerful conversation that we're going to have with her. So to get us started, here's what we know. We know that breast cancer is the most common non-skin cancer found in women. We know it's the second leading cause of cancer-related deaths in women. And we also know the best way to diagnose or to find out if you have breast cancer is through regular screening mammograms. So what we want to find out is, what is a mammogram, when do we get them, how often, and we'll go from there. So my guests today are Jane Jenkins. Jane is the lead diagnostic medical ultrasonographer at Marlborough Hospital. She's been employed at the hospital for 24 years, 20 years of which you have been a sonographer.
That's correct.
What did you do the other 4?
I was a rad technologist.
Oh, is that right?
Yeah.
See, I didn't even know that. And Jean Martin is a certified radiology, CT, and mammography technologist, and she has been at the hospital for 26 years. Well, welcome both of you.
Thank you.
I'm thrilled to have you join me for the next 15 minutes. So, Jean, we're going to start with you. Can you tell us about mammograms, about getting a mammogram in general? You know, why would we want to have one?
Well, typically the guidelines are that a woman should start to have a mammogram once she has reached age 40. Unless she has a family history, such as a mother or a sister, then possibly the start would be age 35.
Okay.
And we do it once every year.
Mm-hmm.
She would go call her doctor. She would be referred, call the hospital, get an appointment.
So you said at the age of 40. Now, do I have one every year at the age of 40, or if my first one is normal, can I skip a few years until I'm older?
We typically like women to come back every single year after age 40.
So it's the day for my mammogram. How do I prepare? Do I have to do anything special?
We do ask women that they come, ahead of time if there's any paperwork that they need to fill out. We also ask that they do not wear any deodorant, as the deodorant can somewhat mar the imaging. So is there something in the deodorant that causes an issue? Yes, it's the deodorant has like the soap. It forms like, it looks like calcifications on the imaging.
So now I've arrived, done all the paperwork, and we're going to do the mammogram. What do I expect?
Well, you can expect the mammographer to come out and call the patient in, ask her date of birth, bring her in, show her her own private dressing room, give her a Johnny, welcome her to the facility and tell her when she's ready to take her time, but when she's ready to cross the hall, come on into the mammography room.
You have been doing this for a long time, and I know that the technology has changed dramatically over the last, 10 years?
Yes.
And so just as a side note, how is the new digital mammography different than film?
It's much better. It is more accurate in detecting early breast cancer in women. It's particularly good for young women who typically have dense breast tissue. It's a quicker exam. Let's see, lots of good boom to the technology changing.
So I have to ask this because I hear so many women say, oh my God, I had a mammogram and I don't know if I'll ever have another one. It was so painful. Are they painful? Do they have to be?
Certainly the compression is tight. It needs to be tight so that the breast tissue can be compressed accurately and you can see right through the breast tissue. But certainly no, it should not be painful. Different women have different pain tolerances, and the paddle can come down slowly, and it should not be painful.
I know that you try to get other tissue besides the breast, so what tissue are you looking at?
We typically try to get way back to the chest wall where the pectoralis muscle is.
Because you can often, breast tissue is there, or you can see adjacent lymph nodes?
Lymph nodes in that area, and you want to make sure that you get as far back in the real breast tissue, and you do if you get back to that muscle.
So if it's really painful, is it appropriate for me to say, stop, this hurts?
Absolutely.
Okay, and then you'll rearrange and try to make it a little bit more comfortable.
Absolutely.
Oh, that's good to know, because it just frightens me when people say,
Sure.
it hurts so bad I'm never going back
Right,
again.
right.
Because there should be, based on what you say, there should be no reason for it to be that uncomfortable.
No.
That's great. So once my mammogram is completed, then how do I find out? When do I know what the results are?
We tell our patient that it's typically a 7 to 10 day wait for a letter to come in the mail. One letter to the patient, one letter to the patient's physician.
And that notification is regulated, correct? There's, I think that's something about mammography that a lot of people don't know, that centers should be certified by the Department of Public Health, the Division of Radiology, as well as the American College of Radiologists. That's really important to look for those two designations.
Yes.
Because that means the quality of the mammogram is meets a set of standards that are national, correct?
That's
that
right.
Every center would do them that way who have those certifications.
Yes.
I think that's great to know. So, Jane, we're going to move on to you. And sadly, I meet you because there's something on my mammogram that is not normal. So what role then does ultrasound play in the diagnosis of breast cancer?
Ultrasound will play the role where a radiologist looks at the mammogram and sees a spot on the mammogram, or if a woman feels a spot, a lump. We will then take that patient into the room and do an ultrasound exam and focus in on that area that we've been directed to look at.
Now, have you always used ultrasound for breast?
We have used it for quite a few years, about 20 years now.
Is that right?
Right.
Wow. So how soon would you say after I'm assuming, Jean, correct me if I'm wrong, if my mammogram is positive or is anything but normal, someone's going to call me?
Yes, you would get a phone call within 3 days.
Within 3 days. And how soon after that, Jane, do you think I could get in to have my ultrasound done?
Well, that woman may often come back and have another few views of a mammogram, and then she will be directed right into the ultrasound department to have a focus look at
So
the breast.
you bring me back to do some additional mammogram films. Do I know then, so I get a personal phone call saying that we want to follow up on something that we saw?
Yes.
So women who arrive for that follow-up mammogram must be pretty nervous. So what do you do, Jane, to, prepare them for what's going to happen over the next hour or so?
Well, we welcome them to the department, and we also engage in personal conversation, trying to tell them it's going to be a comfortable exam, what to expect during the exam. The radiologist will then come in and talk to the patient and give them the results. So for the patient, they feel as though the cycle is complete, and they'll get their information, and that's very important to a woman.
Oh, I can't even imagine. So if I have the additional films and the radiologist takes a look, and everything is fine then, no ultrasound, but otherwise I'm coming prepared to have both, some additional films and the ultrasound on the same day?
It can be arranged that if a finding is made at the callback films, that she will have an ultrasound. We try to allow a little bit of time so that can be done.
Oh, that's great. So I don't have to leave again and wait another 3 days.
We don't want to do that. We want to provide a service that she goes from one room to another.
That's great. So now we're about ready to do the breast biopsy. Is the biopsy itself done by you?
No, it's done by the radiologist. My role would be to show the radiologist where the nodule would be, and he would then discuss the biopsy with the patient, explain a consent form, explain if there's a risk, small risk to having a biopsy, what to expect after a biopsy, when the patient could expect to get the results, and just a complete explanation of what's going to happen in the next few days.
And is it done with a needle after you numb the area, or how exactly do you proceed?
The radiologist at Marlborough Hospital always use lidocaine to numb the area. So they'll prep the skin, they'll cleanse the skin, put lidocaine in, and then put in an introducer, and then do the needle biopsy.
So your job is to locate what they saw on the mammogram?
Correct. And to assist the radiologist in creating a sterile field so everything is done in a sterile manner.
Now, are the are you looking at the mammogram at the same time?
We do. We'll review the case, review all the images before we even go in there. And then when the radiologist comes in and looks over the technologist's shoulder, confirm it's at the exact same spot, that there is a match between the mammogram and the ultrasound findings.
Now, there is ultrasound what's used most often for breast biopsies, or are there other techniques that are used?
There's also stereotactic biopsy that is very, very useful in finding microcalcifications and doing the biopsy that way.
So ultrasound, are you looking, by the mammogram you can tell what you're looking at?
Yes, we're specifically looking for nodules or mass structures.
But if it looks more calcified, then stereotactic is a better choice.
Yes, that would be the recommendation of the radiologist.
Now the biopsy is complete. You send a specimen to pathology to be evaluated. Correct. About how long until I find out?
About 3 days. Those specimens are sent to UMass Pathology.
So mammogram, within 3 days, I know whether, if it's abnormal, I'm going to get a personal phone call from someone and then get scheduled for repeat films. Are they repeat, Jean, or are they additional films?
They're additional.
So
they're part of the first mammogram.
So you would add several more views to really be able to pinpoint what the radiologist is seeing on the screening mammogram?
Yes.
Okay. And then my biopsy is complete, and so in a very short period of time, I could know whether or not I have a diagnosis of breast cancer and I can go on. So, you know, as I said, I just can't imagine getting that phone call in the first place. And how then do you involve your patients in the process? So, Jean, when I come back, do I get to control any of this?
Yeah, when a patient comes back, we certainly know that they're going to be nervous, so we try to make them as comfortable as possible and tell them, you know, we know we got you called back, sorry, it's just, we want to take special good care of you. You will find out your results today, no worries, one step at a time.
Great.
Just to appease them a little
bit. Then you rearrange your schedule so that I can have, if I want my biopsy today, we can have that done.
Yes.
And so by the time now the radiologist has said, we want to do a biopsy of the area. So your goal must really be to settle somebody.
Most of the time, women want to have that biopsy right away. They don't want to wait the few days to be rescheduled and get another time. They want to get that information and talk to their doctors and either find out if there is a cancer or if it's a benign finding.
So they want to keep the process moving.
Exactly.
Great. What an incredible service you guys provide by doing this. I would be remiss if I didn't ask the question about men. I know when we designed the center, we designed some things specifically for men who need to have mammograms. So, Jean, men can be diagnosed with breast cancer?
Yes, usually it's about 1%.
So it's a small number.
It's a small number.
Are their symptoms the same? I mean, would they feel a lump?
Yes.
And how many men would you say you screen?
I would say we may probably see 6 to 10 men a year.
A year, is that right?
Enough.
Oh. And then do they go through the same biopsy process?
They could. If it looked suspicious under ultrasound, they could.
Wow.
Oftentimes it's a benign finding. They've felt a lump or their doctors felt a lump. And if it looks suspicious, we'll go ahead and do it.
So thank you very much. This has been certainly very educational for me, and I hope for our audience as well. We'll take a quick break and we'll be back with our next guest. Hello and welcome back to this edition of To Your Health. Today we're talking about mammography and its role in the diagnosis of breast cancer. And as I indicated at the top of the show, my guest for this half of the program is Pam Jassoum. Pam has been employed as a registered nurse at Marlborough Hospital for 6 years. As you can tell, she's just come from work to spend some time sharing what she's gone through for the last year. Following her diagnosis with breast cancer. I bet you can remember the exact day that you got the phone call.
I do.
And that was?
May 18th.
Is that right?
Yes.
So I can imagine that that's a day that you'll never forget. So, Pam was diagnosed with breast cancer, a little over a year ago. So you've gone through a lot in a year.
I have.
Pam did have her mammogram done at our Women's Center, which is located in Southborough, and I can't tell you how thrilled I am that she agreed to spend some time with us. So Pam, what a year you've had.
It's been a long one.
You are still just as beautiful as ever.
Thank you, Kim.
And I can personally tell you that she's an incredible nurse as well. So
thank you.
I'm going to take you back a little bit.
Sure.
So we're going to go back to May.
Okay.
And you don't fit the typical picture of someone I would think that would go for a screening mammogram. Our guests told us that usually we start around the age of 40 to do screening mammograms. I'm going to guess, without getting too personal, that you're not 40.
Thank
so
you.
Why did
I
you?
am.
You are 40.
I'm 41.
So why did you go for a mammogram?
I had a mammogram back when I was 38. My primary care had she does a baseline at 38, and everything was fine. And I actually found a lump myself, and so I went in for a mammogram to have it looked at.
So by doing breast self-exam and just knowing yourself,
yes,
you found something that was. Now sometimes people feel lumps in their breast. Was there something about this that just really?
This one was a little. I guess it's very misleading. Is a lot of times they'll say that breast cancer is not painful, and I actually had a lot of pain. So I kept at my doctor saying, I think we need to have this looked at, We tried some antibiotics thinking it was, some sort of infection or something, but it wasn't. So that was the characteristic that sticks in my mind. But other than that, it's a very distinct feeling. It's pretty hard. It's a hard.
You schedule your mammogram in Southborough.
Correct, and they do what I was doing at the time, because I had found something, was what they call a diagnostic mammogram, where they schedule you for a mammogram, and if they see something, they follow it up with an ultrasound.
So we heard earlier that when you go in for screening, sometimes you're called back. In this case, because you had felt a lump,
yes,
everything was done at one time.
Correct.
Great.
Yep.
Okay, so you have your mammogram.
Yep, and they were able to see it on the mammogram, went in for the ultrasound, they saw it on the ultrasound, and the radiologist came in and said, you can come back and have a biopsy, or we can do it now. So obviously I chose to do it right then and there and be done with that.
Now, had you brought someone with you, or you just scheduled your appointment? And
scheduled my appointment, yeah.
Based on what you had been through with trying antibiotics, and how long of a period of time was that?
Only about 2 weeks.
Is that right? So it was pretty quick.
It was quick, yes. And Southborough got me in. The Women's Health, they were very helpful in getting me in as quickly as possible.
Oh, I'm thrilled to hear that for you. So the biopsy is done, it's sent off. And how quickly are you informed of the results?
I believe that my doctor was very good about calling. They did it on, I believe, a Tuesday, and I waited all day Friday and kept making phone calls, and by 5 o'clock it wasn't done yet. And on Saturday, my doctor called me on Saturday to inform me.
Is that right? So she called you at home?
I was at work.
Oh, she called you at work?
Yes.
What was that call like, Pam?
I actually wasn't overly surprised. I was actually more angry, but it was okay, and she kind of talked me through it, that everything would be okay, and there's so much that, and she had a plan. She knew exactly how to handle it. She knew exactly what I needed to have done, where I needed to go. It was more the fear of the unknown, of knowing where do you go and who do you see, and she really guided me in that, so that was very helpful.
Oh, I'm sure that it was. Did she just say, Pam, it's positive?
She did call me. She said, I can't believe it, but it is positive. And I said, okay. And it was invasive ductal carcinoma. So you hear that word and you hear your name with it, and it's kind of devastating for a little bit.
Oh, I just can't imagine. So she was really helpful in kind of guiding your treatment from then on. Now, you said you were angry?
I was angry, yeah.
Tell me about that.
Oh, I'm not that old. Actually, at the time, I had just turned 40 when I got diagnosed. And I think I was just angry. But I think it was better to handle it that way than to be upset, and that's kind of just how I handled things.
So why me kind of angry?
Not even a why me, but why now?
Why now?
Yeah. If I was a little older, I might have been able to, but at this stage of my life, yeah, it was more of a why now.
And so, you know, you were a relatively new nurse, so you had just finished, you weren't too far out of school.
Well, I've been out for 6 years.
Oh, for 6 years.
Yeah.
Okay. And, you know, I just can't imagine what it felt like on that phone. I just, you know.
Well, I was trying to work, so that was difficult, and they wanted to send me home. But I talked to a couple of the doctors on the floor at work and got some more information. It was actually a very positive experience to be at work.
Because you were surrounded by lots of friends.
Yes. And doctors and people that understand it. And I think being in the healthcare field makes it a little easier to understand what you need to do and how these things work. And you don't do so much as the why me. You kind of, you know that these things just happen to good people.
And then you go about putting a plan together and sticking with your
Yes.
plan. So now you've had your biopsy done, and what were the next steps?
From there, they do some more diagnostic. They do a CAT scan, full body CAT scan, to make sure that you don't have any metastasis anywhere else in your body. And from there, then they do a breast MRI to see if there's any other cells, because the mammogram and the ultrasound only show so much, and the breast MRI really showed up more, shows up more, which I had more tumors than just the one that I had felt.
More tumors on that side?
On that side.
On the right side?
Yes.
So now you find out about the additional tumors, and you make a decision about where you're going to go for treatment.
Correct.
What treatment options were you given?
Originally, they had talked about just doing a lumpectomy, but when they found that there was more tumors, it didn't make a whole lot of sense to do that. So it was evident that I was going to need a mastectomy. So we started with that, and the treatment is, surgery first and follow up from there. They do all your biopsies, your sentinel node biopsies, where they check your nodes for any tumor cells, and they do that while you're having surgery.
And the sentinel node is a special lymph node
Yes.
Related to our breast, that if that's positive, it kind of guides further treatment.
Correct.
Now, did you just have one breast removed or both?
I had both.
And how did you make that decision, Pam?
That was probably the hardest decision I've ever had to make. It was very, very difficult, and I struggled with that.
Did you do that with guidance, or was it suggested to you to have both removed, or how did you get to that point?
The choice was entirely mine. You kind of weigh the options, they give you scenarios, and they give you kind of percentages of the cancer coming back on the other side and the chances of that happening, and you kind of have to do what's right for you.
And because you are premenopausal,
Yes.
that changes the picture a bit.
Yes.
So the likelihood of cancer coming back, does that increase because you are so young?
Yes, because you're going to hopefully live longer. So it does.
So who did you turn to for support in making, that type of decision?
My coworkers, a lot. They've been very good to me. My friends, my family, and and myself. Really.
There must have been a lot of sleepless nights trying to...
There was.
Although, the decisions, did you have to make them quickly? I mean, did you go from diagnosis to surgery relatively
You had a little bit of
period
time because they have to do the, all their diagnostic testing first. And so I was diagnosed in May and I had surgery in July. So, it's a relatively short period of time to make that kind of a decision. It's a life-altering decision.
It certainly is. It certainly is. Because I know you, you have two wonderful kids at home.
I do. They're wonderful.
How did you have that conversation?
It was very different. My daughter, she's 13. She was a little bit more understanding. She was more upset. Crying, and that sort of thing. My son, I kind of tried to hide it from him a little bit. I figured if I can just do the surgery, I don't actually have to use the word cancer with him, because he was only 10 and I didn't think he'd understand. And it was, we were on vacation. It was after my surgery, and I knew I was going to need some chemo. And I said, I took a walk on the beach with him, and I said to him, you know, Joey, you know, we had seen a young girl at a water park that didn't have any hair. And I said, do you remember that girl? And he said, yes. And I said, what do you remember about her? And he said, well, she had cancer, right, Mom? And I said, yes. And he goes, is that what you have? And I said, yes. And I said, and I have to have some more treatment. He goes, are you going to be bald? And I said, yes. And he looked at me directly and said, your head is going to be cold at that hockey rink, Mom.
Oh, because he plays hockey? Oh, God bless
so
him.
he wasn't, no matter what happened, I wasn't missing a hockey game. So he didn't care, you know, he's 10. It's all about him, you know. So,
wow.
And my daughter was very supportive, and she was there for me, you know, more, she was a little bit more caring and understanding.
Sure.
And it was harder for her.
But it has to be harder for her and for you, because now her life changes too.
It does, dramatically, yes.
Now, did you have a family history of breast cancer?
On my father's side, I had a wonderful aunt actually who survived breast cancer for almost 40 years, back a long time ago, and she'd been through a lot. And she just actually passed away last year.
Oh.
So that was hard for me too.
Yeah.
But she was a great aunt. So they did do some testing, and they did, you know, look at some of her genes, and she did have a BRCA gene, but it was it wasn't a BRCA1, BRCA2 gene. It was a different mutation. So they did check into that, but I didn't have it.
Which is so. Is that will you have your daughter tested at some point?
I will. Yes.
Yes.
Yeah.
Can you just imagine what you've learned over the past year?
Too much.
Yeah, yeah.
Too much,
I can imagine.
Yeah.
So you did chemo.
I did.
A full round of chemo.
4 rounds.
4 rounds
Yes.
of chemo, and you know, having known you for a while, your hair was always perfect, perfect. Every single day, every time I saw you, it was perfect. So, what was that like for you?
It was. I like to think
I know
that
myself
I did it with
and my hair.
dignity. So. I like to think I held on with a little bit of dignity, but yes, it was difficult.
Yeah.
It was difficult, and I tried to make light of it. I tried to, you know, joke it away the way I kind of do things.
Yeah.
But it was hard.
So, how about your mom? And your extended family, how did you manage?
They were wonderful.
As a nurse, did you feel like you had to be the strong person in all of this?
I think it was harder for a mother to see their daughter go through something like that. So I had to be kind of the stronger one, and I tried not to let it bother me as much. And I felt sometimes that I had to be there more for them occasionally, but in the end, they were there more for me.
Yeah.
Yeah.
So I imagine with chemo, trying to raise 2 young children, you had some pretty tough days.
I did, but I had a lot of help.
And so is that what sustained you? Is that what got you through those
Yes.
really tough days?
Yes. Yes.
Well, I have to say that you just look amazing.
Thank you.
And I'm glad to see you so healthy.
Yes.
And now, what are the next steps?
Just really just watch me, I guess.
Yeah.
You know, and make sure that everything, you know, nothing comes back. And you know, I feel like I've done everything that I can, that I need to do to make sure that it doesn't.
That's
So,
and that's.
I can never
think
look back and
that's
say.
Right. No regrets.
No regrets.
I think, too, that you have done everything that you possibly can. Well, thank you so much for spending
Thank
time
you.
with us, and just for having the courage to sit here with me and to share this story.
I'm happy to do it, and I feel that in some ways that's, you know, there's a reason for some of the things that happen to you, and I actually find that I help a lot of my patients with that, and I work over at Women's Health occasionally too, helping out with biopsies, and I've been known to give my phone number out and my email out to women, and I actually have a few women that have contacted me, and
I bet.
And I've been hopefully been supportive for them, and I hope that at least for that, you know, I can be good for that anyways.
So, in closing the program, if you had one piece of advice for women in our audience, what would it be?
Listen to your instincts. Listen to your instincts. It will make things a little bit easier, and trust yourself, and trust your decisions.
Well, with that, I say again, thank you so much.
You're welcome.
And hopefully everyone in our audience takes something very special away from this program. Thank you.